University of Texas. If you haven't seen the press conference University of Texas experts just gave, you should try to find it. I'll just say that we're really lucky to have folks that are as smart and as practiced and as valuable as Dr. Lauren Myers, who did some of the modeling that we're going to talk about here today, and Dean Clay Johnston of the medical school. They are just among an army of just incredibly talented people that are helping to guide us and our community through this period of time. So we're going to begin from hearing from Dr. Escott, who's our public health officer. He's going to get a chance to talk, and then the judge will get a chance to talk. I'll close, and then we'll answer some questions from the media. Dr. Escott.
Good afternoon. As the mayor said, I hope you all have seen the presentation by the Dell Medical School and the University of Texas earlier today. If you haven't, I'm sure that you'll find it on all of the major networks. This is critical information to have because it really helps us to frame what we're talking about, the importance of social distancing. But before I get into the modeling, I want to say a little bit about the two people behind me. At a time when we look for effective leadership through crisis like this, we look to a model like these two behind me. When we face unique challenges, it's wise to call in advisors from public health in this circumstance and ask for advice and direction. When public health officials themselves are facing big challenges and difficult decisions, we convene subject matter experts, and that's what we did through our expert panel. That panel is involved in reviewing current research, past research, so that we can make informed, deliberate decisions. We talk, we debate, and we discuss to come up with directions to give our elected officials. But sometimes the past evidence, the past information is not enough. And that's when we look to researchers, like the researchers at our world-class institution here at the University of Texas at Austin. They're on the cutting edge. They are doing the modeling which is being used around the country and to some extent around the world to look at this particular pandemic. We are grateful for the contribution from the University of Texas. We're grateful for the presentation and the openness of Dr. Clay Johnston, the Dean of the Dell Medical School, to really collaborate with us as elected and appointed officials with our healthcare networks so that we can come up with a solid plan for our jurisdiction. We're particularly thankful for Dr. Lauren Ansel Myers, who spearheaded this project and piggybacked on her prior research related to influenza. So it's important to remember that these models show very clearly the critical importance of social distancing as we tackle this virus and this pandemic. The data shows us that if we were to go back to school in a week, if we were to turn the restaurants and bars back on in a week, if we were to return to business as normal in a week, as some have recommended that we do, by the middle of May, we will be in a catastrophe situation like other jurisdictions are facing right now across the United States and across the world. That is not an option. What we have to do is delay this as long as we can. We have to better prepare our community to answer this challenge. We have to build capacity in our hospitals. We have to build capacities in our ICUs. We have to get more equipment, more personal protective equipment for our healthcare workers and our first responders, and more ventilators so that we can provide better care to more people. This data is not perfect, but it's as perfect as we can get right now. This modeling is consistent with modeling that's been done by other institutions across the world, and we have reason to believe in its ability to at least predict the next several months. So it's really critical for us right now to take this seriously, to do what the mayor and the judge have asked us to do, and that is stay home, work from home, only leave your house if you have to do things which are essential. When we talk about the numbers and the magnitude of difference between what we are capable of today and where we could be if we don't do social distancing properly, we're talking about being 20,000 beds short of hospital beds in a little over a month and a half's time. We're talking about the difference between thousands of lives and less than that, which could be impacted by this. We're talking about saving thousands and thousands of people in this city alone. We're talking about saving hundreds of thousands of people across the United States and across our state of Texas. And it's critical that we do this right now. I'll be happy to take questions at the end, but before that, I will ask Judge Shara Eckhart to step to the podium.
First off, I just wanted to say thank you to our amazing community that has already achieved a 50% reduction in both business and personal interactions. That is tremendous. And my gratitude goes out to our community that has shown such unity to get to that 50% mark. But we're asking you to do more. I'm not going to sugarcoat this. COVID-19, beating it, requires that we get to a 90% reduction in personal and business interactions. And we can do this. We can do this if every one of us, before we leave the house, ask ourselves, is what I'm about to do essential to the health and safety of myself, my family, my community? If it's not, stay home. If it is essential, please follow the guidelines that have been laid out so clearly with regard to social distancing and hand washing, because our lives are literally in each other's hands. There's no doubt that there is that COVID-19 is hurting us economically. That is true. But there is no greater economic resource to us than our health and safety. There is nothing better than gathering with family, with friends, with community, with colleagues, and we will all be together again sooner if we stay home and work safe. I want to express my deep gratitude to our whole community for joining us in this fight for our health and our safety. I want to thank the University of Texas, all of our industry leaders, our leaders around Travis County, and also our leaders around Central Texas, who've banded together to help us get to a 90% reduction in both our business and our personal interactions. Thank you. Thank you in advance. Thank you for joining this fight, and thank you for winning this fight along with us. And with that, Mayor?
You know, there are a lot of cities around the country right now and around the world that are dealing with this virus in pretty drastic situations. The wonderful thing for us in this city is that we have it within our control as to whether or not we head in that direction or in a different direction. And I take a large measure of hope from that. Because I like having it being something that we can impact and that we as a community get to decide. I want to make sure that we take a look at the charts that were presented by the researchers, by Dr. Myers and Dean Johnston today, because they tell us our ability to be able to impact our future. The charts show us, as you can see on this, the time goes across the bottom of the chart. The numbers with a 50% reduction, the numbers are, you can see the lines are in red. This is hospitalizations in our city. Now, these models are just models. They take into account a lot of factors. A lot of things could change, but based on the best information we have right now, as Dr. Escott said, in just a month or two, we could be 15,000, 20,000 hospital beds short. That's going to require us to start building temporary shelters, erecting tents, commandeering or taking over or getting use of buildings. 20,000 beds. But if we get to a 75% reduction level, look at the decrease that makes. And if we get to a 90% reduction level, that means our existing hospital capacity can handle what's going to be coming to us. And we get to decide based entirely on whether or not we can rally the community will to reduce the number of daily contacts that we have in our city. You know, there are a lot of charts in the University of Texas presentation, and I urge everybody to take a look at them. It looks at ICU units and other things, but I want you to look at this next slide. This is the mortality slide. This is a very serious slide because we know that this virus has the capacity to get some people so sick that they die. Now, it's a small number relative to the number of people that will get the virus because it's like the flu. A lot of us are going to catch it. But even that number is one that we have the ability ourselves to decide what kind of impact we have in our community. The numbers again, with a 50% reduction in daily contacts, we're talking about thousands and thousands of people that we'll lose. That number, if you go look at the University of Texas slides, something over 5,000 in our community alone. But if you get to a 75% reduction, look what this does. If you get to a 90% reduction in daily contacts, we're going to be able to save most everybody. This is the choice our community gets to make. We get to decide if we're here or if we're here. And I will tell you that it's going to take all of us making this choice together if we're going to reduce daily contacts. They're individual choices, but it's the collective number that matters. You know, a day or two ago, I was looking at the number of people that were playing and swimming together in Barton Springs. That makes everybody in this city less safe. You know, the age group in our city that is the highest percentage of getting infected with this virus? It's people 20 to 29. And people that are 20 to 29 might not even know that they have it. But when they interact with other people, and they do, they pass it. And then the people that they come into contact with pass it. And it passes on like that, perhaps reaching the ones that are most susceptible in our community. So we get to decide. But there is such incredible hope and opportunity in recognizing we get to control this. And I think that really was the message that the judge gave you and that the two of us really wanted to communicate to the community. You know, a couple of days ago, Governor Cuomo in New York, who's overseeing a pretty grave situation. He's on television every day. Some of you may have seen him. He was describing and looking at pictures of the hospitals in New York, and he said to everybody in the country, look at these pictures because this is your future in just a few weeks. And the unfortunate thing is that probably is going to be true in many communities. But it does not have to be. We can do this differently in our city if collectively, which means individually, but if all of us together decide that we're going to do better, we can, and we will see the benefits of that in helping to save those that we love in this community and save those of us, the first responders and healthcare folks that are at the forefront of this. Thank God for them. Let's help keep them safe too. So with that, I think we're ready to answer questions.
With the Chronicle, I'll be asking questions on behalf of the press corps. So first I want to ask, is the current remain at home order, is that aimed at achieving the 90% reduction in social interactions? And then if you could kind of like help people understand what that looks like. Is interacting with 3 people in a day too much? 2 people, one person? What does that actually mean?
You want to take that one? Okay.
So that 90% reduction means if you interacted with 10 people normally before the stay-home order, we want you to interact with 1 person outside of your home. That's the kind of order of magnitude of change that we need to see because anytime two people get together, face-to-face in particular, there's a risk of transmission, particularly if that's within 6 feet. So that physical separation of 6 feet, if we're in public places that are still open, and that decrease in number of those person-to-person interactions, as the chart shows, are going to be very, very effective at limiting the spread, really containing it. Remember, the disease is dangerous, but it's most dangerous when it spreads very, very quickly. Because as we've seen in New York, the hospitalizations go up very quickly, and those hospitalizations are not sustainable. And when you stress the healthcare system, that means that more people are going to die that could have been saved if we stretch that over a much longer period of time. So that's what we're looking for, a tolerable amount of people getting sick at a time so that our healthcare system never gets overstressed. We never have to look after people in tents because they're best looked after in hospitals, and we can provide the best care for them there.
And so is the stay-at-home order, would that achieve a 90% reduction?
We're going to see. Right now, this 3-week period is really to give us an opportunity to catch up on the testing, to get a better picture of which direction we're headed. Are we still headed at a doubling rate every 4 to 5 days, or are we stretching that out over a longer period of time? It gives us an opportunity to shore up our plans, our additional healthcare sites, increasing surge capacity in hospitals, identifying new sites of places that we can care for people. And it also helps us to buy time to get the model even better. So the more information, it's sort of like weather forecasting. The more information that you feed into the system, the better that model is going to get to help us look further into the future.
Gotcha. And so the modeling seems to make some assumptions about numbers of ventilators on hand. Does that include like what we have currently, or is that including what we're expecting to get, what's been committed to us?
And that's the number that we're trying to get hard numbers on now. If you can imagine, there's lots and lots of hospitals in our region, and we're doing this as a regional plan. It's not just Austin and Travis County. We're working with our partners throughout the region to get numbers, because this certainly affects all of us. So we really want to work as a unit. There's lots of different hospital beds, there's hospital types, there's ventilators in different parts of the community, not just in the ICUs. So we're trying to get the total number as well as the new stock that has been ordered since this crisis began, as well as anticipating what additional inventory we can expect to come in. I'm refreshed to see that we have many companies that are working at building new ventilators, including Dyson, who makes vacuum cleaners, GE Healthcare. We're seeing lots of companies that are retooling their factories to create more capacity for those ventilators so that we have better ability to take care of people if they do get sick.
Gotcha. This next question comes from the American Genius. They say, we're getting hundreds of reports of non-essential businesses still going on. So what is the city doing to meaningfully enforce the stay-at-home order, aside from just announcing the fines?
You know, the orders that have been entered, both by the county judge and myself, come with the force of law. So those orders have the capacity to have someone fined or to have somebody put in jail. But as a practical matter, this is not something that we could ever truly enforce to the degree that would be necessary for this to actually work. This is something we're going to have to enforce among ourselves. This is something that we as a community are going to have to want enough so that we police ourselves and so that we remind others around us who might not be noticing that this should be top of mind. This either works or it doesn't work, not based on our ability to enforce it, but based on what value our community together places on thousands of lives here. That's really the question.
And this is from the...
May I on that point? Just quickly. I'm a former prosecutor, having worked as an assistant county attorney. Enforcement is extremely important. There's no doubt. But much like smoking, the way we get to really drastic behavioral change in order to assure our health and safety is by giving people the information so that they can hold each other accountable. It's this kind of information that's going to make it possible for children to educate their parents, for parents to educate their parents, for businesses to hold each other accountable, to say, really, we have got to get to a 90% reduction in personal and business interactions if our community hopes to meet this threat. Enforcement by law enforcement agencies will be a last resort. We want to use our law enforcement agencies to educate and to assist people to the greatest extent possible in getting this kind of information out so that we can help each other in this fight against COVID-19.
So the next questions are from the statesman regarding homelessness. What specific steps is the city taking to prevent the spread of COVID-19 among people experiencing homelessness? Are there places where they'll be able to go to isolate or quarantine if they get sick? And just kind of how much of an impact would that community have on the local hospital system?
So as we're developing our emergency response, there's been particular attention paid to those of us that are the most susceptible in our community. And those that are experiencing homelessness in our community are in that group. We have rooms that are available right now so that if someone experiencing homelessness in our community is testing positive, they can be quarantined. We're also getting and putting online larger spaces. We're looking at, and I think in the process of obtaining hotels and other opportunities so that if it requires a larger number of people, we're able to handle that. But in the short term, in the immediate term, if we started running into that situation tonight, we're prepared to make sure that those people and the impacted people are separated. That does bring to mind the people that are most susceptible of this. You know, we should be trying to put a cocoon around the folks in our community that are older and have compromised immune systems. And we should all be trying to do that with people in our family. That's why you have the orders that say, you know, don't go visit nursing homes right now. If you have someone who is older living in your home, you know, try to avoid the contact that they have, even with grandchildren and the like who are out interacting with other people. We should try to put a cocoon around those of us that we're trying to protect the most because they're the most susceptible.
We got one from CBS Austin. Regarding concerns of hospital overcapacity, what resources are the city and county looking into to combat potential shortages in beds or supplies? What, if any, places are being considered to serve as backup locations for accommodating those needing hospitalization?
So we have a number of options. First, we have the ability to expand capacity within our current hospitals. In addition to that, we have other healthcare settings that's like surgical hospitals that aren't seeing patients now. We have other healthcare facilities. We have facilities that used to be hospitals, and we're looking at all those options as opportunities to expand our bed capacity, our ICU capacity. In addition to that, we are looking at other spaces, including hotels, that we can use to house people with more minor needs, as well as the possibility of turning hotels into hospitals if we need to.
And so this one is from Community Impact. They're asking, does Travis County or the greater Austin area have any contingency plan to accommodate more rural counties bordering the greater Austin MSA, which are typically far less stocked with available beds than the metro areas, should there be a need?
So we are working closely with our regional partners on this. This is partly through our Capital Area of Texas Regional Advisory Council. We have bed counts of all the beds within our region. And we're working closely with them to ensure that we are working as one unit together on this issue. We have many folks who work in Travis County and live in a different county. We have folks who live in Travis County and work outside of Travis County. So we really have to do work together on this. You know, we recognize the fact that our rural communities have less hospital and bed capacity. They have less redundancy. They have less public health resources. So the City of Austin and Travis County is serving as a resource for all of our region so that we can ensure that our partners and our friends are well taken care of.
And this is from
Can I
Kate.
quick tail on that for a moment? Also, I want to assure those who are listening and viewing that we do have a tremendous collaboration regionally. So we have, the mayor has been on regular phone calls with all of the major metro mayors. I have also been on a continual text string with all of the county judges in every single one of the major metros across the state, as well as on a text string and frequent contact with every municipality inside Travis County, as well as the counties surrounding Travis County. The reason for that is obvious. As major metropolitan areas, we do absorb a lot of the responsibility for the health care that goes on in our suburban and our rural counties. And we are proud of that. We are proud to play a role in a health care network that should be statewide. We would prefer to have a statewide strategy. In the absence of a statewide strategy, we are working very collaboratively, regionally, and across regions throughout the state of Texas.
And this is from KUT. It's about enforcement, but specifically if APD has any plans to break up groups that are still gathering on the hike and bike trails. We've seen the photos at Barton Springs that have been really distressing to people. Big public gatherings like that, does APD have a plan to deal with those?
So whenever we find those, our law enforcement are stepping out to address them. I've been actually encouraged by some of the pictures I've seen of Barton Springs, both before we issued our orders and after. But if we're going to get to 90%, then there's still work to be done. And again, we can put out all of our police, we can put out all of our code enforcement, and we're not going to get to 90% unless this community decides collectively that it's important to get to 90%. And if the community decides that collectively, then we can get there.
This is from KXAN. In a UT medical call today, Dr. Clay Johnston with the Dell Med School said that the city could move patients to places like the Irwin Center, Convention Center, or old hospitals in Austin if we hit capacity, hospital capacity. So are those viable possibilities that the city is exploring?
So as I said before, we're looking at a number of different options. Some of those includes large spaces, like the ones mentioned. Other options are hotel rooms where we can physically separate individual people. Hotels are more similar to hospitals than convention centers are. But we may have options to do some of both depending upon the situation. We do have multiple teams working on these very issues right now to identify the best sites for use, both as hospital-type sites as well as shelter-type of sites for those who don't have a place to go to. We want to be very clear that if we have individuals who are positive for COVID-19, their home situation needs to be safe. It needs to be effective at preventing spread even within the home. So some of those things involve, is there a separate room that individual can stay in? Are there few enough people in the household to limit social distancing? Other important factors are, is there somebody at home who is elderly or who is at high risk for a complication? If that's the case, we want to offer a place for those individuals to stay where they can not risk the individuals at home.
So this is from Univision. Is there any evidence or data that shows that the shelter-in-place order is actually influencing people to stay home?
Dean Johnston today mentioned a couple of sources of data on the impact of shelter-in-place based on the proximity of cellular phones to one another. That shows that it's having an impact. It's not nearly where we need it to be. We're happy to say that Texas is scoring an A on that, but that only gives us to about 50%. We've got to do better.
So the City Council is set to approve a really sweeping resolution aimed at providing economic relief to people all throughout the city. And, people are really needing assistance now. So, Mayor, when do you think people will actually begin to see that assistance arriving from those actions the city staff is being directed to take?
Just as soon as we can, and I don't have a real good answer to that question yet. We all have been leaning into the federal government because that's really where the greatest assistance can come at a level that will be the most meaningful. I'm real appreciative that the federal government passed what it did this morning. That's going to be bringing checks to many people, most people in our community. The city, by the resolution that we have, is directing and having our economic development department to start stepping forward with things like rental assistance and mortgage assistance. The social service agencies at both the city and the county are taking a look at redistributing the funding that we give to focus it and direct it on the people that need it the most. We have some folks in our community that aren't going to be able to take advantage of unemployment insurance because they weren't employees. We have some people that are not as connected with the government as others, and we as a city and a community need to make sure that we are reaching to everybody in our community to make sure that they're getting the help that they need just as quickly as we absolutely can.
So this is from another from the American Genius. Is the city considering any residential rent freezes given the rise in layoffs and furloughs?
So at this point, our advice is we don't have the power to be able to give a rent freeze or to a mortgage holder to give them the ability not to have to make mortgage payments or the like. But what we can do, and what the City Council is going to be moving forward today, and what we have already done, tries to get us as close as we can. Austin Energy and Austin Water will not be cutting off the power to anyone during this period of time if they can't pay their bills. And while rent continues to accrue, the action that the City Council takes today and an order that I've entered today says that we're not going to either hear or be able to initiate eviction proceedings. So we're doing what we can in order to keep people in their homes and not being kicked out as we figure out exactly what it is that we're facing here. You know, part of this work, everybody reducing the number of interactions is going to give us more time to put everything in place.
And from the Statesman, what is the average length of stay for someone who has to be hospitalized for COVID-19? And why are some tests taking 9 days to return as opposed to the 3 to 4 days that patients are being told?
So there's some variability in the hospital stay. The ICU hospital length of stay used in this model was about 10 days. There's some variability for non-ICU hospitalization between 5 and 10 days. Really, it depends on the individual situation. It depends on the level of underlying medical illness in the individual, their age. All of those things are going to impact that individual length of stay. Thank you so much.